pharmaceutical opioids, mainly tramadol and codeine.
As part of efforts to curb cultivation and production of illicit drugs in Nigeria, the NDLEA is adopting an alternative development plan that will encourage cannabis farmers switch to other licit crops. NDLEA chairman said this at the opening ceremony of a two-day sensitization program and training on drug prevention, treatment and care, organized by NDLEA for Governors Spouses Forum in Abuja.
As we convene here today, we must recognize that substance abuse permeates modern society, affecting individuals, families, and communities, regardless of age, gender, or socio-economic status. As the spouses of governors who are chief executive officers of their states, you occupy strategic leadership positions in your respective states, and you are in the right positions to spearhead efforts that could help to curtail the scourge of illicit drugs. The challenge of drug abuse has become a public health concern. 6 years ago, the National Drug Use Survey showed us that 14.3 million Nigerians between the ages of 15 to 64 years abused psychoactive substances other than alcohol and tobacco, and 1 in 4 of such individuals was female. We also got to know from the findings of that 2018 survey that cannabis was the main drug of use in Nigeria, followed by pharmaceutical opioids, mainly tramadol and codeine. The report in its entirety was worrisome, and the trend in society at the time, especially the widespread abuse of tramadol and the emergence of new psychoactive substances that were abused indiscriminately by Nigerian youth, called for urgent measures to stave off the drug abuse epidemic. Moreover, the rise in violence and the descent into insecurity put pressure on our society to find a way out of a vicious cycle that was understandably partly catalyzed by the availability and indiscriminate abuse of psychoactive substances.
In a keynote address, the special guest of honor, the First Lady of Nigeria, Senator Oluremi Tinubu, tasked the states to see the war against the drug menace as a collective effort.
Drug abuse is not merely a law enforcement issue. It is a public health crisis that demands a compassionate and comprehensive response. We must challenge the stigma surrounding addiction and cultivate a culture of empathy and solidarity towards those battling substance use disorders. As mothers, we understand the profound impact that drug abuse can have on our children's lives. Therefore, it is incumbent upon us to protect, nurture, and guide them towards a future free from the shackle of addiction.
The Attorney General of the Federation and Minister of Justice, in his remarks, commended the resourcefulness of NDLEA leadership in utilizing the Nigerian Governors Spouses Forum to cascade the drug war into the grassroots and the community level.
Youths represent the most active and vulnerable group that are predisposed to social vices once adequate parenting and supervisions are absent. By fostering a culture of prevention and promoting healthy lifestyle, we can mitigate the risk factors associated with drug abuse and empower our youths to make informed choices. Equally important is our commitment to expanding access to evidence-based treatment and rehabilitation services for those struggling with substance use disorders. We must ensure that individuals seeking help receive the support and care they need, free from stigma or discrimination.
Minister of Education, represented by the Permanent Secretary in the Federal Ministry of Education, emphasized the pivotal role of First Ladies and the fight against the scourge of substance abuse.
Today's theme is especially pertinent as we confront the scourge of drug abuse, which has inflicted grave physical and mental health challenges across our country. Prevention, as they say, is indeed better than cure. Our focus must therefore be on proactive measures, including education, community outreach, and policy initiatives to deter substance abuse. Now, regarding support, we are all in this together. If you are fighting the good fight against drugs, thank you, and needing a helping hand, we in the Federal Ministry of Education are there for you every step of the way.
Other speakers at the opening ceremony spoke in same light, calling for collective and collaborative efforts across society to curb the menace of drug abuse.
I would like just to amplify some of them. And in particular, of course, I'm speaking here to the first ladies of the various states of Nigeria, because many of these fall in your direct or indirect sphere of influence. The first one is the issue of creating community-based drop-in centers. Now, in addition to the issue of treatment centers, and I will speak on that one as well, I think it is very important to bring the assistance and the services as close as possible as we can to the actual persons that need those services. So we need to move basically from a concept where we have treatment centers, maybe at state capital, maybe at senatorial district, to much closer move those services to the people actually affected by drug abuse.
Significant challenges in combating drug abuse and trafficking. The country serves as a transit hub for drug traffickers due to its location and extensive international connections. Distressingly, the National Drug Law Enforcement Agency, NDLEA, reported that over 40% of Nigerian youth engage in drug abuse, contributing to the high prevalence of substance use disorders. Excellencies, distinguished guests, ladies and gentlemen, combating drug abuse, you will agree with me, requires a multifaceted approach that encompasses prevention, treatment, and support. There is need, however, for increased investment in prevention programs that target vulnerable groups, including young people, schools and communities, as well as expanded access to treatment, services for those struggling with addiction, while comprehensive public awareness campaigns to educate the people should be sustained. We in the States do a lot of this sensitization campaigns. It is in this regard that I commend the agency's extraordinary commitment and tireless efforts, which has led to the remarkable reduction in the demand for illicit drugs within our borders. Furthermore, the ceaseless and successful efforts of the agency in intercepting and disrupting the illicit drug access from foreign countries into Nigeria are a testament to the resolute leadership and the agency embodies. These efforts of the agency has no doubt lessened the burden of the economic and social consequences of drug abuse and illicit trafficking among our people, while also projecting Nigeria in a positive light among the Committee of Nations.
Drug abuse takes away person's capacity to make informed decisions necessary to protect them from HIV and other diseases. Working with NDLEA and UNODC, I'm happy before we enter this hall, Oliver was telling me we've made substantial progress in terms of working together to introduce what we call medicated assisted therapy and needle syringe program as part of harm reduction intervention to prevent HIV.
Recent studies have confirmed that use of drugs is whispered in Nigeria. We all know the consequences of drug use, therefore, we have a common responsibility to prevent drug use and ensure a human right-based treatment and care. I can reassure you that drug prevention, treatment and care services is also one of the 3 pillars of the European Union Drug Strategy 2021-2025. This is done through prevention of drug use, raising awareness of the adverse effect of drugs, and ensuring access to and strengthening treatments and care services.
Spy TV News reports that major stakeholders at the event, which includes the First Lady of Nigeria, Attorney General of the Federation and Minister of Justice, as well as Chairman and Chief Executive Officer of the NDLEA, charged state governments to prioritize the fight against substance abuse in their strategic work plans for a safe and secure society. Olaimi Eson, for Spy TV.
Friend.